My name is Mary Ellen McCarthy, and I'm 42, and I'm from Bear, Delaware. I'm originally from Philadelphia, but I live in Delaware right now. I was diagnosed with uterine fibroids back in 1999 before I even had kids. My doctor diagnosed me upon exam, and they did not present any significant problems. In 2006, I moved from Baltimore to Delaware to take this job with Gore, and it was a big deal. It was changing jobs, moving. I had been divorced. Actually, since I was pregnant with my daughter, I had been divorced for a while. So I was doing it all alone, new daycares, new schools, so much more stressful than I thought it was going to be. And not long after that, I began to, my symptoms increased. And that same year, 2006, I had a uterine artery embolization to treat the symptoms from the fibroids, and that was successful for a temporary period of time. So about a year and a half later, the symptoms returned, and I began to think, what's my next step? And the doctor I had was a new doctor for me. I, found this doctor through a referral, and he suggested I consider a hysterectomy. And at that phase, I was okay with losing my uterus. A lot of concerns about my sex drive, and that was a good thing in my life, and I didn't want that to go away. So we scheduled an abdominal surgery. I asked my physician if I was a candidate for laparoscopic surgery, and that's about all I knew, is that was an option. And he indicated that I really wasn't because of my fibroids. At about the same time, I found the Hysterectomy website and immediately recognized it as a great resource because it wasn't slanted one way or another. And through that website, began to learn more, and I learned about the Vinci surgery, kind of followed through to the website, read the testimonials. The testimonials really these were real people, and even like the Hysterectomy website, because to me these are real people who are sharing real stories, and that weighs a lot to me. And so I called, through the surgeon locator, I found 2 doctors in the Delaware area, and I had an appointment with both of them. One the next day, and it couldn't have gone better. She spent a great deal of time with me, just explaining my diagnosis from the report I had. It was about 24 hours. I had surgery just before noon on a Monday, and I was released about the same time on Tuesday, and it probably could have even been a little bit sooner, but they had some things you had to do before you go. When I left the hospital, they wanted to make sure I did 2 things: that I could tolerate the Percocet, the oral tablet they gave me, and I also had to make sure I went to the bathroom. I peed. And so that was no problem. When they removed the catheter, I went without any problems afterwards. And the Percocet I tolerated just fine. And in fact, they said, you can take 1 or 2, depending on your pain. And I said, well, I'm not in a great deal of pain. In fact, I didn't need the IV medication in the span that I was eligible for. So I took 1 Percocet and thought, okay, I'm fine. But that night, the pain really got away from me, and I should have been taking really 2 Percocets, every 4 to 6 hours. And everybody said this, especially with Hysterectomy, don't let the pain get away from you. So surgery Monday really turned the corner in terms of pain Friday. And I think for my first outing, I went to Kohl's to get, like a department store, to get some loose-fitting sundresses. Then I began to sort of itch to drive a bit, and my doctor wanted me to wait 2 weeks, and I kind of had a suspicion I'd be ready to go a little bit before that. But I just wanted to start helping get them to camp in the morning, so just cheated a tiny bit. When I had surgery and I was going in for the last final hallway into the surgery room, the nurse yet another nurse was asking, okay, what are you having done today? Name, and they verify all your information. And when she was done, she said, so are you excited? And I said, well, I don't know that excited would be the word I'd use, but sure, yeah, I'm excited. I don't know, I kind of went with it. And she said, I just had this surgery 3 weeks ago. And she was back in the hospital working. And I said, no, did you really? And she was like, yeah, let me show you. She shows me her scars, and it was just this last minute boost I needed. It was almost like a last minute banner advertisement for Da Vinci. She had had the same surgery, so it was great.